Hey guys, and welcome to another episode of MedVise TV, where pharmacists like myself give you the information you need to better manage your health and medications. Today's topic, how to kick the habit. My biggest struggle in preparing this topic was to decide how much information I wanted to provide on the importance of smoking cessation. Organizations like Truth have already done a really good job in the media at showing why it's super important to quit smoking and the dangers of continuing to smoke. But I did decide to give you one sentence on why it's super important to kick the habit. Smoking causes multiple cancers, heart disease, stroke, complications of pregnancy, COPD, and many other diseases. On average, a smoker's lifespan can be shortened by about 14 years. Oh, and one more thing. Okay, it turned into two sentences, I'm sorry. Smoking can increase the risk of having a heart attack or a stroke in women that are taking birth control. So, be careful, ladies. Today, we're mainly going to talk about the ways to quit. Your options for quitting are trying to do it cold turkey, acupuncture, hypnotherapy, behavioral therapy, medications, and counseling with a healthcare provider. I usually only recommend counseling with a healthcare provider and medications because studies have been proven that those are the most effective. And in combination, counseling with a healthcare provider and using medications to quit smoking have been proven to be the most effective. Quitting smoking is very difficult. A lot of people are not successful, especially if they try to do it cold turkey. And sometimes it takes multiple attempts, but stick with it. It's important you do. So, you've decided that you want to quit smoking. Where do you even start? The first thing to do, pick a quit date. Pick a quick day. Pick a quick date. Pick a quit day. Pick a quit day. That's a really hard thing to say. Pick a quit day. That's right. Name the exact date that you are going to quit smoking. Write it down somewhere. Put it in a note on your phone. Put it on your calendar. Just pick a date. Next, try to start figuring out what your triggers are. What's likely to cause a craving? Or maybe you have no triggers. Maybe you just need to wake up in the morning and right away you need to have a cigarette. These are all things that are super important to find out. Whatever the case may be, you need to figure out and understand what your triggers are when you're smoking and why you're smoking. Certain triggers for smoking can be stress, certain types of food, or like having a meal, like lunch. It could be social situations, maybe when you're going to the bar or maybe when you go to concerts. Triggers can also be coffee, meal breaks, working, driving, walking the dog, or even talking on the phone. A lot of times it's drinking alcohol, and especially drinking alcohol in social settings. I have a lot of friends that only smoke cigarettes when they're out drinking in a social setting. Even matches, lighters, and ashtrays can be considered triggers for smoking and causing a craving. So once you've found all your triggers, write down a list of those and make it a point to avoid your triggers. If it's the ashtray or the lighter, try to get rid of those. If it's a certain social situations, and make it a point to try to avoid them. Knowing your triggers also helps in determining what type of treatment you may or may not need. So now you're thinking to yourself, now what? How do I actually quit? I'm glad you asked. I recommend that everyone trying to quit smoking use a nicotine replacement treatment, or NRT for short. I usually recommend an NRT for everyone unless it's medically contraindicated or there's a clear specific reason that you shouldn't be taking a nicotine product. NRTs provide a controlled amount of nicotine to help with withdrawal symptoms and to help with cravings. But before you start any medications to help you quit smoking, make sure to talk with a healthcare provider or your pharmacist, because changing the way you smoke can actually have a certain effect on certain ailments or other medications that you may be taking. Now, there are 5 different types of NRT options. You have nicotine patches, nicotine gums, nicotine lozenges. You also have a nasal spray, an inhaler. Oh, and there's e-cigarettes, so there's 6. Bonus. The 6th one's a bonus. There are also prescription medications that are pills that you can take to help with smoking cessation. These don't contain nicotine, but most of them have really bad side effects, and I usually only recommend these when using an NRT product has failed. These medications are also used to prevent cravings and also decrease symptoms of withdrawals. Most of the NRT products are available over the counter and without a prescription, with the exception of the nasal spray and the inhaler. Those need a prescription. The different NRTs all have different dosages. They're used differently throughout the day, and your dose depends on the number of cigarettes you smoke per day, your level of nicotine dependence, how soon you need a cigarette upon waking in the morning, and previous experiences trying to quit. According to the manufacturer's label on NRT products, usually treatment lasts about 6 to 8 months. But if you need to use an NRT product longer than that, by all means, that's something you should definitely consider. Make sure to talk with your healthcare provider or pharmacist before doing so. People who shouldn't use nicotine replacement are people who have just had a heart attack, are pregnant, have heart arrhythmias, or have angina. In addition, the inhaler or the nasal spray should not be used in people that have asthma or COPD. Now, before going into the specifics about the NRTs that I recommend and how to use them, I want to first address e-cigarettes. A lot of people that come to the pharmacy to ask me what's the best ways to quit, they always ask about e-cigarettes. At the time of this recording, e-cigarettes have not been well studied, and we don't really know what the true short-term or long-term effects or risks of e-cigarettes are. However, it is possible that e-cigarettes are a great option for quitting smoking, but unfortunately there's just no real hard evidence or proof to show that it works or that it's safe. E-cigarettes do have some drawbacks. Sometimes we don't actually know how much nicotine you're getting in each one of the inhalations that you take. There's actually some studies that show that you can be getting more nicotine from an e-cigarette than an actual cigarette. In addition, there's also been studies that people are likely to get more addicted to e-cigarettes than cigarettes. Another drawback of e-cigarettes are they potentially also can contain carcinogens, which can cause cancer, which is one of the main reasons we want to quit smoking in the first place. My overall recommendation for using e-cigarettes is if you have tried other nicotine replacement products and they haven't worked and you really don't want to take any of the prescription medications, I would definitely think that the e-cigarettes might be a better option for you. Now, let's dive deeper into the nicotine replacement products that I usually recommend that's available over the counter. You might be asking yourself, what's going to be best for you? Well, everyone is different and everyone has different lifestyles, so it would be really hard for me to provide a blanket statement on what would be best specifically for you, but please reach out to me if you're ready to quit and you want a specific plan for you. Send me an email and I will do my best to help. But in general, chronic smokers, people that smoke every day, should probably start with a nicotine patch. They can also use a nicotine gum or a lozenge to help with any cravings that still might arise while taking the patch. That's right, it's okay to use both a nicotine patch in conjunction with a nicotine gum or lozenge. Now, for people who are more social smokers and people who do not smoke every day, the patch might not be a good idea for you, and likely you're going to benefit more from taking just a gum, the lozenge, or even the inhaler or the nasal spray. It is important to note that if you start your plan using a nicotine replacement product and you do have a slip up and you do have a cigarette, it is okay. You can still be on both at the same time. Just pretend like that cigarette didn't happen and continue on with your plan. A bonus of using an NRT to quit instead of trying to quit cold turkey, quitting cold turkey actually can cause weight gain in a lot of people. Some men, but mostly women, have a real concern in quitting smoking because of the possibility of weight gain. But the good news is a nicotine replacement product actually can delay that. So you may have to change your diet and increase your exercise if you do quit because of that possibility of the weight gain. But because of nicotine replacement products, weight gain can no longer be an excuse. All right, now we're going to talk about using the individual different types of nicotine replacement products. First, we're going to start with patches. Nicotine patches are long acting, and again, these are more for the chronic smokers. Nicotine patches are usually worn throughout the day. As stated earlier, the amount of dosage that you start with for your nicotine patch can vary depending on how many cigarettes you smoke per day. Usually use one patch every 24 hours. However, some people using a nicotine patch can have some really vivid dreams, or they can have trouble sleeping. If this happens to you, you can just remove the patch right before bed and put on a new one in the morning. It is important not to cut patches to try to get a specific dose. Cutting a patch can cause it to not work properly, so don't cut patches. Also, remove the patch if you're going to be having an MRI. To apply a patch, make sure it's on a clean, dry, and preferably hairless area of your body. Anywhere on the torso is going to be great, like your arm, your chest, your back. Just don't go below the waist and don't go above the neck. Now, when you're applying the patch, make sure to remove the adhesive, and when you put it on there, try to hold it down for about 10 seconds. Make sure not to use more than one patch in 24 hours. Patches can cause mild skin irritation. To minimize this, just rotate the places where you put your patches. You can use hydrocortisone if your skin does get irritated, but make sure to not put a patch on a place that you use hydrocortisone, as it's not going to stick well. Make sure to wash your hands after applying and removing your nicotine patches, as you can get nicotine residue on your hands in that process. To dispose of your patch, after you remove it, fold up the sticky sides and you just throw it in the garbage. Now, let's talk about nicotine gums and nicotine lozenges. When using these, make sure to wait 15 minutes after eating or drinking anything other than water, because anything other than water can actually decrease the absorption of nicotine into the system. Nicotine gums and lozenges are used for people who have cravings while taking a nicotine patch, or more for social smokers, the smokers who don't smoke every day. As with the patches, the dose you use is determined by how many cigarettes you need to smoke per day. Now, when chewing the gums, make sure to chew very slowly until you feel the effects of the nicotine, which usually is from tingling or a specific change in taste in your mouth. Once you feel that, park it. Well, what do you mean park it? Parking is when you store the gum that you've just chewed in between your cheek and your actual gum. This is gonna help with absorbing more nicotine into the system. Parking usually lasts about 30 minutes. When you don't feel that tingling anymore or that taste is gone, start chewing again and repeat. Now, if you're using the gum by itself and you're a chronic smoker, you really want to make sure you're using this every 1 to 2 hours and for a minimum of 9 times a day. But if you're using it in conjunction with a nicotine patch, or if you're more of a social smoker, you only use it as needed. All right, now we're going to talk about lozenges. Using a nicotine lozenge is very similar to how you use the gum, except do not chew the lozenge. It is meant to slowly dissolve in your mouth. While dissolving, let the lozenge move around your mouth. It usually takes about 30 minutes to dissolve. Only use one lozenge at a time. Taking more than one or taking a lozenge right after another can increase your chance of side effects. Doing this can cause hiccups, heartburn, and nausea. Let's talk about the prescription nicotine replacement options. This is the inhaler and the nasal spray. The inhaler is great for people that want to get the action of putting the cigarette to the mouth, which helps a lot of people cope with quitting smoking. These come in cartridges that you place into an inhaler. To get ready to use, remove the mouthpiece and then insert the cartridge. You should hear a pop when the cartridge has been properly inserted. Then replace the mouthpiece and twist, and it's gonna be ready to use. You can then puff on that inhaler with very short, frequent inhalations. Each cartridge is good for about 20 minutes of active inhaling, but after opening, it's only good for 24 hours. Make sure to clean the cartridge regularly with soap and water. And finally, we're going to talk about the nasal spray. The nasal spray provides the fastest delivery of nicotine for both cravings and withdrawal symptoms, but it does have the highest potential for dependence. It's really good for immediate relief of symptoms. The nasal spray needs to be primed before use. It should get about 6 to 8 sprays until you see a fine mist coming out. Then it's going to be ready to go. Now that's only on the first use. If you haven't used it for 24 hours, 1 to 2 sprays is usually enough to prime the nasal spray. Before use, make sure to blow or clear your nose. Do not sniff, swallow, or inhale that spray. You're going to want to tilt your head back and you want to give 1 spray in each nostril. It's just a spray. Again, do not sniff or inhale the mist. So let's recap. Smoking cessation is really hard, but it's really important. Don't try to quit cold turkey. Use nicotine replacement products for your best chance of being successful in kicking the habit. And find out what works best for you. There's so many different ways to quit smoking. You really gotta find what's best for you. Please, if you need any help with smoking cessation, send me an email, richard@medvise.com. As always, do not start or change the way you're taking any medications without first talking with your healthcare provider or your pharmacist. Below in the link, I'm going to include a lot of other resources that you can go to if you need more detailed information about what we just talked about. Thanks for watching and take care.